Well, it's finally time. COVID-19 vaccines are now available to everyone 16 and older. To find and schedule an appointment, go to vaccinelocator.doh.wa.gov. A message from the Washington State Department of Health. And since COVID is still trying to, mess with our sports schedules and things of that nature. We got athletes, star athletes that are coming down with it. Fernando Tatis Jr. of the San Diego Padres just coming down. Look, it's a part of our life, and the pandemic that has taken it over for the past 15 months. And now since vaccinations have been rolling out for the last several months, we want to get a little bit of an assessment. And here to talk with us about that and then some in regards to it, and we'd like to welcome in here to the program Miss Benita Presley. She is a volunteer at the Vancouver branch of the NAACP and works for Wellness and Recovery on the Go there in the Vancouver-Portland community. Benita, we appreciate you joining us here on a Wednesday afternoon. How are you feeling here on this afternoon?
I'm feeling very good today, and thank you for having me on today.
Absolutely.
To talk about this.
Absolutely, and there's a lot really to grasp and gather. Number one, just talk a little bit about what you do in regards to wellness and recovery on the go, and your experiences with the community and trying to get a grip on this pandemic, especially since the vaccinations have rolled out.
So, for the last year and a half, I'd say I've been really talking about the pandemic, and I work in the recovery community in Vancouver-Portland area for anybody that has substance abuse issues. So that's one of the main areas I deal with: domestic violence, peer-to-peer mentoring. So I wear quite a few different hats, but right now we're focusing on COVID pandemic, and that has been a real problem for us this last year at least. And we're finally getting some relief with the vaccinations, and we're hoping to have people, if they choose to go do that, get it done so their families can be safe from it, and hopefully we'll have enough people get vaccinated that we can go back to some type of normalcy here soon.
What is your professional experience in the recovery community in regards to those who have contracted this virus? You get to talk about a little bit how that it's affected them or it's continued to affect them, and maybe talk a little bit about the risk-reward factor, the risk of getting or contracting this virus versus getting vaccinated and trying to keep you as healthy as possible.
So with the COVID pandemic, they've talked about having underlying conditions, and that could be diabetes, it could be heart condition, it could be the condition where you have coughing. COPD is the proper word for that. Anybody that has asthma or a chronic cough, those are considered underlying conditions. So if you were to get the COVID-19 pandemic, you would be worse off because you have those other underlying conditions. So without having the vaccination, most likely you would have been hospitalized, and worst case scenario, you would have been put on a ventilator, and worst case scenario, you would not have pulled through it. So we've had many cases of that happen in our community. We've had a lot of people that were hospitalized and ended up in ICU. So just with the drug addiction being an issue for people and families that have that issue, you automatically have some other issues, whether it be diabetes, cancer, leukemia, kidney dialysis. Those are some of the things that go along with having a drug addiction, or the after effects of having the addiction. So it's a very nice pandemic to come along just to add on to that.
Benita Presley joining us here on GameTime Sports Talk, courtesy of Wellness and Recovery on the Go. And she also is a volunteer at the Vancouver branch, the NAACP. She's found some time to give us a little bit of vaccination education. Now, I'll say this, Benita, I will announce, and I have announced a little bit earlier this morning, I did get most of the Moderna shot. As my producer's looking at my badge of honor right now, of course, I feel excited about it, and I've really had different conversations with people who've been hesitant about getting the vaccine. Those who, of course, you can wait on, are waiting on others to get it, see if there's any ill effects, the data that comes back in regards to it. And I understand and am sensitive to the resistance to the vaccinations because of what has happened in our community and communities of color throughout the years in regards to whether it be vaccinations, the health, we don't have a good history in regards to this country in regards to it with different diseases and other things that have spread and have disproportionately affected our community and communities of color very much more than the main should we say population. With that being said, I'd like to ask you, what are the conversations that you have with those who are hesitant to get the vaccines? What are their concerns, and how do you ease their concerns? Have you had a lot or any success in easing their fears, easing their concerns to go ahead and get vaccinated?
Yes, I've had a lot of pushback in the African American community, and like you said, it's from our past experiences with other diseases that have come up and in the past that we've had to deal with, and especially with this one we had where the vaccinations for African American, Latino, American Indians, they weren't readily available to us and in our community or even easy for us to access. Mm-hmm. So that was the first issue that we had. Secondly, it was, do we wait and see what happens when somebody else gets it? That's been the biggest question mark that I've seen. And people are just afraid because they don't know what the underlying effects. There have been people, they haven't been able to just pinpoint and say, yes, this person passed away because they got the vaccination. I have yet to see the stats for that actually saying that's what happened, but the word was out, so people have become afraid. What I can say is that because we have a lot of elderly people in our families and people that are in the nursing home, it's a great need for us to, for people that are in the community and our relatives to get the vaccination so that they can be safe to be around us, because they have spent this last year and some months without being able to have constant visitors, and it's already a lonely place and space for them to be in. So for them not to have consistent visitors every week and not know the thought of the unknown, having to be with them every day, when am I going to see my loved ones, has been very hard on them. So I'm saying all that to say that we really have to take into consideration what our other family members are going through. I just recently had a great-grandchild be born, and I have grandchildren ranging from 6 months to 23 years old. So with that said, I also have to be worried about, are they going to give it to me if they get it, or would I give it to them if I get it? So it's a give and take situation, really. We have to be concerned all the way around for each and every one. And it's a matter of, if you have doubts, questions, I would talk to your doctor. I would talk to somebody in the mental health field that could help you process your thought process and see if they can get you to feel safer and make a better decision around it if you're reluctant. Some people, it's against their religious beliefs. So, we have to just be careful in how we're telling people to go about getting it, but it is something that has to be addressed.
Benita Presley joining us here on Game Time Sports Talk, heard on 1620 KYIZ in Seattle and also on 1480 KBMS in the Vancouver-Portland area. Benita comes to us courtesy of being a volunteer at the Vancouver branch of the NAACP and courtesy of Wellness and Recovery on the Go. That's some good information that you put out there. I mean, there are some different myths that I've heard. Some are saying that they're reluctant to get the vaccine because it just seems like it magically appeared. This vaccination was developed quicker than anything else that we've ever seen. And I guess maybe you can speak to maybe some of those misnomers and give a little bit of education in regards to how long this vaccination has been in the works, and of course how it came to the emergency use, and even up to date as of this week, getting the emergency use for the 12 to 15-year-old population to be vaccinated.
So I can definitely understand why people are thinking this just magically came about, and all of a sudden there's a vaccine for this. And we have cancer that doesn't have, some cancers that don't have anything that's curing it. But I think the bigger picture is looking at it affected the whole entire world. Everybody we're all on the same playing field right now. Everyone had to stay home. Everybody's having to wear the mask, or everybody's being told to wear the mask. I don't think everybody's still wanting to wear them. But we're all having to do some of the same things in order to overcome this pandemic. And that has never happened before. So there's no big you, little me's in this situation. We're all having to do equally the same thing. And depending on how well you do it, or if you comply with what's being said, will be the outcome that you get. I do know that wearing your face mask, sanitizing, washing your hands constantly, and the 6 feet distancing, that will keep you definitely free from getting the actual symptoms that people get, and then you get the full-blown pandemic. But I would say that, you have to really think about the bigger picture is we got our children that are getting ready to go back to school, probably full-time in September.
Right.
And obviously want our children to be safe. And what I know about children are they like playing tag. They don't like wearing the mask. They don't like to have anybody say, well, you can't sit by your friend. And I know they're used to being on the playground playing. So the 3 feet and 6 feet distancing are probably not going to work for long once they all go back to school at the same time. So we're going to have to take a look at using the vaccination as a means to know that our children are safe and our adults are safe from this pandemic. So I don't believe there's going to be too many ways around it. But again, it's all about keeping everybody informed and educated. And anytime we have new information, I will be passing it on and spreading the word as much as possible.
Absolutely, and we appreciate that. Benita Presley joining us courtesy of Wellness on the Wellness and Recovery on the Go, and volunteer with the NAACP branch there in Vancouver, Washington. Benita, before I let you go here about your Wednesday afternoon, and we appreciate your time. Maybe speak to those who and plead for why it's important to. I guess to personally, you've already talked about it, to not only get vaccinated, but why it's so important to try and get as close to herd immunity as possible, making sure that at least 70% of the population has at least one dose in their arm.
Well, I think it's really, this pandemic is like, I've had to look at it as a life or death situation, because I've seen people that came down with it and went in the hospital and didn't make it coming out. And it's sort of like a silent killer. We don't know. You can walk around with the symptoms and not even know that you have it. Mm-hmm. And unfortunately, you can be around people and be a carrier of it and give it to someone and not know that. So with all that said, I think that we wouldn't want to purposely do that to anyone. So it's a matter of getting more educated about it, talking to friends and family, talk to someone that did get the vaccination and see what their experience was, and then sit down and make a family decision about what it is you would like to do about it. Because the bottom line is we can't all depend on somebody else getting it to make us safe. It has to be a personal decision so that we all become safe at some point. And next week I will have more numbers for you and more stats so that people can understand. Some people like stats in order to figure out, is it really real, or how close are we to this or that, and I will have that available so we just have more information to give. But the main thing is just to keep yourself abreast on the information that's out there. The vaccinations, what I will tell you is that the vaccinations, they're going to have free rides and transportation via Lyft, Uber, and the phone number is 1-800-525-0127 or call 211 in your local area, and they will be giving transportation for people to get out to go get your vaccine. So that's one thing that was a big problem and barrier for people. Originally was, how am I going to get there? First it was, where do I go to get the shot? Now it's, how do I get there? So we have a way for you to get there, and again, that's call 211 in your local area and 1-800-525-0127.
We appreciate it as always, Benita. We're looking forward to speaking with you over the course of the next few weeks. Benita Presley comes to us courtesy of a volunteer at the Vancouver branch of the NAACP and Wellness and Recovery on the Go. We appreciate your time and the information, and we look forward to speaking with you here in the very near future.
Absolutely. You have a great day, and I will talk to you next week.
Absolutely. We have a great one there as well. That is Benita Presley joining us here on Game Time Sports Talk with some very important vaccination education here. And speaking of which, COVID-19 vaccines are now available to everyone 16 and older. To schedule your appointment, go to vaccinelocator.doh.wa.gov. A message from the Washington State Department of Health.